The Omicron variant continues to create havoc around the world. I'm Barkha Dutt. This is the Mojo Story. We'll be talking to the key South African doctor at the front line of the COVID battle as the tremors are continuing to be felt globally. Let's take a look at the key developments so far. There now seems to be global consensus that a third shot is needed to complete the COVID vaccination course. While vaccines continue to offer protection thus far against the new variant, the seventh variant, the Omicron, the World Health Organization is indicating that there is now confirmation of its greater transmissibility. The good news is that all of the cases continue thus far across 58 countries to be mild, but political tremors are being felt as Pfizer is calling for possibly a fourth shot, not even a third booster. There are calls in the United Kingdom for Boris Johnson to resign over a Christmas party that his office is accused of hosting last year while London was under restrictions. To talk about how Omicron may or may not change the course of this pandemic, we are joined now by South Africa's Salim Abdool Karim, as I said, a foremost epidemiologist and expert at the front line of this COVID battle and the new phase in this battle. Welcome to the program, Professor Karim. It's a pleasure having you on. Let me get straight to it. Do you think the world is overreacting? South Africa is obviously very upset at the travel bans, and I agree with you, they're absolutely senseless. Omicron's already present across the world and community transmission in many countries. It cannot even be linked anymore to travel. But on the ground, what is South Africa seeing now, sir?
Lovely to see you, Barkha. It's a great pleasure to be with you here today. When we first saw this new variant, I was aghast. I said, wow, there are so many mutations. And what struck me is that Omicron has mutations in it that are the same and confer advantages to the alpha variant, the beta variant, the gamma variant, and the delta variant. And so initially there was a very high level of uncertainty as to what its more than 50 mutations might actually do. And so I can imagine that caused anxiety, that caused panic, that caused overreaction. But now the situation 2 weeks later is quite different. Mm-hmm. We have preliminary data. We understand this virus now a bit better than we did 2 weeks ago when we first announced it. And we have a better understanding about how we can deal with this virus. And so yes, we did have that panic, we did have that overreaction, but the time has come to ease that and to just say we have a better understanding.
What is that better understanding? Your colleagues on the field have been telling us that the symptoms continue to be mild, but they wanted to wait another week. They wanted to take the variant into day 10, day 11 before they could confirm that. Can you now confirm that all of the cases that you're seeing in South Africa from the Omicron variant continue to be mild?
So let's just take one step back. The first is that we in South Africa have been anticipating a new variant. We've been anticipating that we will have a fourth wave. This is not unexpected. And we wanted to ensure that we had in place the mechanisms to answer the three key questions, which you have touched on. Is it spreading faster? Does it cause more severe disease? And does it escape our vaccine immunity? Well, we can answer those questions now with preliminary data, so it's not definitive answers. The answer to the first is yes. It transmits fast. How much faster? There's a paper that's appearing tonight in the journal Lancet that provides these estimates. In essence, when you compare the rate at which the virus is growing, in other words, the doubling time of the cases, it is faster, it is doubling faster in this fourth wave due to Omicron than it did with our beta or our delta waves. So it is spreading faster. And based on that, we can expect it's going to go to many countries pretty quickly. And when it is there, it will spread at a rapid rate. Mm-hmm. The second question you've asked, which has really been a key critical question, because we have been expecting that the virus would evolve to get more advantage. It is not to the virus's advantage to make people more sick. Because if it makes them more sick, they stay at home, they stay at hospital, they don't spread the virus. The less sick people are, the more the virus can spread, because then they're going to work, they're traveling in public transport, more people can get infected. So we've been anticipating it would be less severe. The early data that we have seen shows that patients who've been admitted in the last 2 weeks under our fourth wave have been less severe than all 3 previous waves. How much less severe?
So hang on. Let me hold you there. Basically, prima facie, Omicron is more transmissible and less virulent. Am I summarizing it correctly?
You hit it on the head.
Okay, go on. You said it is more transmissible, but more mild than alpha, gamma, delta, beta. Did I miss anything? Right. Yeah.
So let me give you some numbers that might help, actual data.
Yeah.
So when we look at the admissions we have had in the main city that's affected most by Omicron, where the first cases were described in South Africa. It's called Pretoria, or the new name is Tshwane.
Yeah.
That when you look at the hospitals in Tshwane, and you look at all of the admissions in the first 3 waves, our first wave was from the D614G variant. Our second wave was beta variant. Our third wave was delta variant. So when you add all those admissions and you look at how many of them were severe, and you define severe as needing oxygen, as needing ventilation, as needing ICU admission, and death. So all those categories are what we would call severe. So if you go to a hospital, you don't need oxygen, or you don't need to be ventilated, you're not regarded as severe.
Yeah.
Well, in the past waves, 65% of our admissions were severe. In other words, 2 out of every 3 admissions in our first 3 wave were severe cases.
In the earlier waves, right?
That's correct.
Okay.
In the current wave, in the first 2 weeks of this current wave, we have severe cases account for 24% of the admissions. So that means that now it's only 1 out of 4 of our patients meet the criteria.
And not all of these severe cases are Omicron. These are a mix of the variants, right? The severe cases, it's not as if all of them are Omicron.
That is correct. But we have an easy way of identifying patients who have Omicron, just using the Thermo Fisher PCR. They have one gene that's negative. And what we know in Tshwane right now is just over 90% of the cases are Omicron. So Omicron is already dominant within 2 weeks in Tshwane.
So, and the third question, so we know more transmissible, definitely distinctly more mild, not really that need for oxygenated beds that we saw in the earlier waves. The most important question is, anecdotally, according to your field work, how are the vaccines holding up?
Right. Let me just make one small correction to your summary. And that is that we are now only looking at 2 weeks of information.
Sure.
Now, severe cases can often take longer. In other words, you become severe in week 3, week 4, week 5.
Sure.
So it is possible that the picture I've outlined may change over time.
Yeah.
Then I want to make that as an important caveat, because these data come from Dr. Wasila Jassat, who is the person at our National Institute of Communicable Diseases that collects all of the hospital admission information across our entire country. So the data I'm providing you with is the data that comes from the official data of our country.
Fair enough. But the vaccines?
Right. So what is it we know about immunity? Can this Omicron variant escape immunity? Well, there are 2 kinds of immunity. The first is natural immunity. People who were naturally infected previously they have immunity. Well, what we do is we have in our system, every person that tests positive on PCR, we can check if they've tested positive before. It's really a system to reduce duplicates. But we can also identify whether they were infected in one of our previous waves. And what we've seen is a rapid increase in the number of reinfections. So that means that what it suggests at this stage, preliminary as it is, that people who were infected in our previous waves, who had beta variant infection or delta variant infection, they have little or perhaps no protection against Omicron. They are still getting infected with Omicron.
So it's like is it like a new virus or not quite, because the vaccines are still offering protection to some degree?
So it's not quite the same as not having any past infection, because we still are waiting for more data on the severity of the cases in people who've had past infection and compare that to people who don't. I don't have that data yet.
And that was going to be my question. It's one thing to get reinfected. It's another thing to end up in hospital or needing an ICU. And I think the question at this point is that the singular purpose of the vaccines was to avoid, first and foremost, ICUs and pressure on the hospital systems, and of course, morbidity and mortality. Do you find that the vaccines are still performing that role, even if diminished? Because what happens is that when you have Pfizer, for example, saying you now need 4 shots, or it's the 40% drop in antibodies, the layperson doesn't understand that the drop in antibodies is not the only measure of whether the vaccines are working.
Yeah, you've touched it right on the head. So what we have seen is that for those individuals who've received 2 doses of the Pfizer vaccine, the antibody levels that are required to neutralize Omicron need to be about 40 times higher than what we have seen with the previous variants. So this new variant needs a much higher level of antibodies, a level that is not available in people who've been vaccinated, several months ago. So we would expect to see some breakthrough infections, and we are already seeing that in our hospitals and clinics, but they've been generally mild because the vaccines, regardless of which vaccine, the vaccines so far seem to be doing really well in preventing severe disease, hospitalization, and death. Now, when you look at that, it doesn't matter what the variant is, the data from all over the world, data from Qatar, from New York, from Israel, all of those data point to the fact that actually it doesn't matter which vaccine you're using or which variant it is, the vaccines do quite well in preventing severe disease.
And that's true for Omicron as well.
That is correct. For now, the early evidence, and it's very early, suggests that that's also true for Omicron.
So why are we talking about a 3rd and a 4th shot?
So that's not something that I'm aware of. This is a press release from the company that sells those shots. So
that's right.
One would want to know exactly what the underlying data are. I learned, over the course of history, I don't take drug company press releases too seriously until I've seen the actual data.
I'm so glad you said that. So let's forget what Pfizer and Moderna are saying, and let me ask you, the big debate in India, for example, is should we be giving a 3rd shot to at least frontline workers and the elderly when the entire adult population has not yet received the 2nd shot? I would ask you as an expert, forget what the pharma companies are saying. Do you now believe a 3rd shot? I'm deliberately not calling it a booster. Do you now believe a 3rd shot is necessary to fight Omicron? Or do you believe as long as the vaccines are holding up against severe death and disease, the 3rd shot cannot be the priority?
I have to say that there simply isn't data to answer that question. All I can give you is speculation and opinion.
Okay.
The actual data to support, will a 3rd shot reduce the chance of you getting Omicron? is a question that remains unanswered.
Okay. So what would be your suggestion for the world at this point, a world that has gone back to closing borders but will not mandate vaccines?
I think it's, for me, a very fundamental issue is that you cannot fight a pandemic like it's a problem of an individual country. You cannot fight a pandemic and expect to win that battle if you are putting up fences between us, if you are creating barriers between us. The way you fight a global threat is to stand together and face it together and use our collective wisdom together. Unfortunately, Omicron came at a time when countries were unclear about what to do, and their immediate reaction was stay away from us, keep away, we're not going to have anything to do with you. That is the wrong thing to do. That's no way to fight a pandemic. So
I agree.
I believe we have at a global level the resources to fight this. That means making vaccines available, making new treatments available, sharing expertise and knowledge and resources about keeping people alive. I think all of those things, we can defeat this virus if we put our mind to it.
I just want to briefly go back to the debate around boosters. You said there's not enough data yet available to answer that question. Some countries like the United Kingdom, the US of A, have opted to go ahead with the third shot for everybody over 40. Are you saying we don't even know if that necessarily offers more protection? Or are you saying technically the more of this vaccine you get, the more it's likely to raise your antibodies, because the antibodies are falling? And again, I'm underlining that the antibodies are not the only measure of how your body protects us from COVID. But how do you grapple with this question of the booster? And I'll tell you why I'm still pushing ahead with it. In my country, there are people not showing up for their second vaccine. There are vaccines about to expire. And there's one view that says, rather than these vaccines going waste, let there be a third shot for those at the front line.
Yeah, I think part of the problem is that there's a political imperative to be seen to be doing something. And right now, if you tell people that the thing they need to be doing is to wear their masks, you've been telling them all the time. That's nothing new. So that's not going to get anybody anywhere. People want a sense that those in charge have their best interests and are doing something active, not just keep telling them wear their masks. Whereas wearing your masks is really important. Now,
what is your final position on the third shot?
Right. So what we do know, and this is not related to Omicron, what we do know is that there are two groups of people who do not develop very high antibody levels when they take two shots of an mRNA vaccine. So if they take two shots of the Pfizer vaccine, they have lower antibody levels. And those two groups are the elderly, so that's people over the age of 60, and immunocompromised people. In both those groups, there is a good case to be made to take a third shot, especially immunocompromised people. 40% of them don't react and don't respond to 2 doses of Pfizer. So giving them a third dose is really good. In fact, giving them a fourth dose may also be good. And the elderly, they would benefit from taking a third dose about 6 to 8 months after their second dose. So those two groups, in my view, it is incontrovertible or less contentious. The evidence is supportive that they should be given a third
Okay,
shot.
that's very clear. What about the non-mRNA vaccines, the AstraZeneca, the Covaxin? Not every vaccine in the world is an mRNA vaccine. In fact, most of the world is using the AstraZeneca vaccine.
So that's a bit more challenging because the data are not really there to make that judgment. What is clear from two studies, one done by the National Institutes of Health in the US, where they compared people who've had a vector vaccine like the Johnson & Johnson that if their subsequent dose was an mRNA vaccine, they do much better in terms of antibody levels. If antibodies are important, which we think they are, then you would do better getting a heterologous boost. In other words, not taking another vector vaccine, taking an mRNA. There's clinical data that comes from Sweden, where they have people who mixed and matched because they ran out of AstraZeneca vaccine. So they've shown that people who took 2 AstraZeneca vaccines don't do as well as people who took an AstraZeneca followed by a Pfizer. But taking 2 Pfizers does even better in protecting against Delta. So that's for the Delta variant. That's what the evidence is. So there's a good case to be made for those who've taken 2 doses of other vaccines to, if they are in that group above 60 and they are immunocompromised, they should take a 3rd dose. And they should preferably take a different 3rd dose.
I think that's very clear. You're not saying no to boosters or 3rd shots, but for those above 60 and those who are, maybe grappling autoimmune disorders or immunocompromised in other ways. My last question to you: given how the world is reacting, partly hysterical, partly a kind of travel apartheid, as a South African, what would you like to say to the world today?
I think that we need to work in an environment of uncertainty. And we need to not press the panic button too quickly, because it doesn't help. Doesn't help those pressing the button, and doesn't help everybody else who has to deal with the consequences. My appeal to everybody, as we were dealing with Omicron, we are going to deal with more variants. Make no mistake. This virus is not done with us, that we will be seeing new variants. This is a lesson for us about how to deal with new variants in the future. That is, when we see a new variant, we need to put our collective resources, deal with it, standing together.
Well, I think that the world owes a debt to South Africa, to people like yourselves, for being so transparent, so quick in alerting the world to the 7th variant, and there will be many more on the way. Thank you for your service and thank you for your time today, Professor Salim Abdool Karim from South Africa. It's a pleasure learning from you today and talking to you, and we'll be in touch again soon. Take care and stay safe.
Thank you. Bye.
Thank you. Bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust